Hi, I'm Dr. Jim Carlson from the Grove Animal Hospital and Holistic Center. And this morning I'm going to be talking about case number 00339, 14-year-old Maltese, current symptoms of biting paws and causing some raw irritations on the feet. And the current treatment is a little bit of prednisone just to take the edge off. I'm not a big fan of long-term steroid use because you can cause a lot of metabolic changes with it. So short-term use, we keep it under control, to alleviate some of the problems associated with inflammation. And so, but what's happening is that on the IHT analysis, we notice on the base point readings that the lung is showing weakness, or the chronic phase. There was no stress phase, and this was the only point. So that's the main contributor at the molecular level to cause the biting paws. So what happens? Well, dogs have, it's kind of three tiers. So initially you have behavior that's controlled by the circulation of the heart. My pen stopped working there, so heart. And that supports the GI tract. But then the GI tract supports the lungs. And the heart it controls the lung. But we're seeing an outpoint to the skin, okay? So that's the symptom, but we're not coughing or sneezing. But following this pathway is really where the underlying problem comes from here and makes its way to the lung and then out to the skin. So this is the layer that we're seeing, biting at the paws. So we use prednisone short term to just get control. We use a probiotic to help with the GI part. We use the hemp oil to handle the lung support. And we've got ginkgo, which handles the behavior. And so we want to use these products, prednisone short term. The other products we want to use up to 3 months to get things balanced out. So we're trying to stay as natural as possible to control this pathway. So there'll be questions, and just call 847-541-4005 to call with questions. You can use our Grove email, growpets@yahoo.com, if you have questions after hours. And certainly when we get the products together, if you have any questions at that point. I'd like to follow up each month to track progress, because I think it's important in the short term as we're getting the body reconditioned, is that we want to be sure that we're making good progress in the meantime. So really healing from the inside out. Thank you so much.